Welcome back to The Layers We Live. I'm Dr. Loree Johnson, therapist, trainer, reproductive health advocate, and someone who's lived through more than a few layers myself. And around here, I'd like to think that we talk about real stuff, mental health, reproductive health, and the ways that impacts our identity, our grief, and our healing, and how that's woven into just our everyday lives. Because some of those most defining moments, they're the ones that no one sees, the ones that we don't always have words for. And so this is our space to pull back the curtain, get real, and share these conversations that matter, the ones that don't always happen out loud. In today's episode, we're talking about recurrent pregnancy loss, an experience that is more common than we realize, but it's often shrouded in silence, shame, and isolation. And when a loss happens, in general, we know it's devastating. And when it happens again and again, sometimes without answers and often without adequate support, it becomes something entirely different. And recurrent loss isn't just about the body, but it impacts your sense of safety, your sense of identity, your relationships, and your trust in the future. And it creates this cycle of hope and heartbreak that can feel impossible to explain. So today I'm joined by Megan Hansen from the Recurrent Pregnancy Loss Association, and we're going to have a conversation about what it's like to carry the weight of multiple losses, the grief, the fear, the numbness, and the quiet strength that it takes to survive something unthinkable more than once. Thank you, Megan, for being here. How are you doing today?
I'm doing great, and I'm so excited to be here. I'm so grateful for you for doing this. I don't know if I've been following you for years, but I think I found you listening to a podcast.
Oh,
too.
really?
I think I heard you on a Sisters-in-Law's podcast, and I remember, and then I started following you on Instagram, and then I reached out. But I'm so grateful to be talking to you. There are so many accounts on Instagram, but when I found yours, I love your perspective, and the content that you put out is so honest and so welcoming. I'm very touched to be here.
Oh.
And I thank you for sharing your story and creating a space that invites other people into it.
Thank you. Thank you. I think this is all about community, and community means a lot. I think that's where I found a lot of my healing, and it's truly an honor to be on this side of the process to hold space and to facilitate these conversations. And so I'm really excited to kind of get into more of a deep dive around how you came to this work, and also how that's really informing what you're doing to support our community. And so if you don't mind sharing a little bit about, how you came to do this type of work.
Yeah. So by way of personal experience, as I think so many of us, it always feels like it just happened yesterday, but actually It's quite past history at this point. My first pregnancy was in 2015. So 10 years ago at this point.
Wow.
So 2015, that was when we tried to start our family. And the short version of the story, right, is that we got pregnant really quickly, and we thought we were so blessed that we knew people that had struggled to get pregnant. We didn't. We got pregnant right away. It was like, oh, great. This is when we planned. Everything worked out. And even conceptualization of the thought that may not be realized. And our first loss was a missed miscarriage. So we didn't know that anything was wrong until that 8-week appointment when we went in and things weren't looking proper, measuring the right way. And so it was quite devastating. And we heard, I think, what most people hear in that situation is like, this is a common thing. And gratefully, they said, this is something that you didn't do anything wrong, and try again. And I think when it's your first loss, you think, okay, you just take that at absolutely face value. Like, great. Okay. I'm very sad. I will do my healing, and then I'll try again. And we did that, and tried for many years, and many treatments, and many doctors. And then at the end of the road, had experienced 6 pregnancy losses in as many years. And I'm happy to go into details about like all parts and all pieces of that, but we can save that for later on. But at the end of that, just came to a point where it was like, oh, I don't want to do this anymore. My body can't handle it. My heart can't handle it.
Yes.
And so at that point moved on to other family building options. But when then my husband and I were sitting down and like reflecting and saying, well, God, what do we do with this? Like we've just gone through this immense period of something, and like it felt like something needed to come out of it. And for us, it really was real frustration. And maybe this tells you something about like the type A personalities that we are, but we were like, there should be more answers here.
Yes.
And so we really wanted to work towards finding more answers for more families. And that's why we started Recurrent Pregnancy Loss Association.
I love that. I love that. You know, and yes, and like you said, so much of our experiences really shape how we come to the work that we do. And I didn't know that your first loss was a miscarriage. So was mine. And, and so when you think about where you are with your first loss, and like you said, you'll heal and, kind of try again, but it really makes me think about how the experience starts to shift with each subsequent loss. And I'm curious, what did you start to notice that happened to your body, or your relationship with your body, and your, just your life in general with each subsequent loss?
Yeah. And it was such a roller coaster. I think there were a couple points at which things really shifted and changed for me. I think certainly there was a lot more anxiety going into the second pregnancy.
Yes.
So that was and I would say that like the level of anxiety heightened with every subsequent pregnancy. But I think that going into the second pregnancy, even if there was more anxiety, which there was still pretty hopeful. And I think what happened at the second loss was this, in addition to the grief, this sort of like sinking feeling of like, oh no, this is now looking like a trend. Like this isn't just a once-off statistical anomaly it is a statistical anomaly, but like, it felt like, oh, there might be something deeper going on here. And then that started to feel really scary. And then the next phase for me involved, we had trouble getting pregnant the third time. So there was a lot that went into that. And we, at that point, sought out the help of specialists. That phase in my head lives as this sort of like, I'm going to make my body a temple. Like I'm going to be perfect. If I behave perfectly and I do everything that they tell me to do without error, I will be able to have this outcome that I desire.
Right.
And when that didn't work, it was really bleak. It was like grappling with the reality, which is that like we actually have very little control in this process.
Yes.
That was really hard for me to deal with.
I think you're just touching on, I'm sitting here nodding like, yep. I can identify with every, kind of phase of that progression, the increasing anxiety that happens with each subsequent pregnancy. And, and I think it's important to name that for people who are going through this, because I can't tell you how many times I hear in sessions with people who've had these really traumatic, journeys to achieving pregnancy. And then they say, I just want to relax. I just want to enjoy this. And I'm like, well, your body's been through a lot, and it's a normal response to have anxiety and to have that anxiety increase. And then also thinking that if you can control with, for certain factors, that's going to impact your outcome. And I think surrendering to the fact that we have maybe a little bit of control, but, ultimately we don't have control over what happens sometimes to, get the outcome that we want. So yeah, I was just furiously like, yeah, exactly.
I would say at that point, like that kind of anger and disappointment in my body kind of continued. I also became really angry at the medical system. My last two pregnancies were IVF pregnancies. We thought that we would try to, maybe it was an issue with embryo quality. And so we pre-tested the embryos, and that was kind of supposed to fix it.
Yeah.
And I think that when that also didn't work, it was like, okay, so now my body has failed me. Now medicine has failed me. Like it was just a lot of, I think at that point, so much of my grief was manifesting just as anger at like everything. That was sort of the trajectory for me. But I love what you said, because like I tell that to people now too. Like rather than trying to stop yourself from feeling anxiety or
Yeah,
stop yourself from feeling angry, like, let's just accept that's normal. And like, how do you deal
exactly.
with it?
Exactly.
Yeah.
Exactly. And I totally understand people wanting to find the joy, right? Like, I mean, you work so hard to get that stage of pregnancy and wanting to embrace it. And when you take into account everything that you've been through, what your body has been through, what it's, still remembering, how can we give that space? How can we allow that space so you can, get to the joy, and I don't think people, and I get it. We don't want to feel uncomfortable. We're sick of feeling uncomfortable. It's like, been there, done that. I don't need to do it again. Can I just get a break here? And I totally understand that, and I think it's so important to hold that space and to name it in order to tame it, so to speak. Yeah. Yeah. And I'm curious when you think about, when you talked about like the cycle that you went through and, the anger, how your grief was manifesting in anger with the medical system and all of that. I'm curious, did you notice anything about how it affected your relationship with your husband or your, friends, family, community?
Yes. Although I think that the way that it impacted the relationships was sort of relationship specific, right? It impacted
Yeah.
different relationships in different ways.
Mm-hmm.
Certainly it took a big toll. And I'm going to start here because I think that this is something that we're uncomfortable talking about, like
Mm-hmm.
marriage relationships and like
Right.
intimate relationships
Right.
publicly. And so we
Yeah.
don't talk about that, but it
Yeah.
has such a profound impact on intimate relationships.
Yes.
And it did for us. I will just, I'm a huge advocate for therapy. And so I
Mm-hmm.
was in therapy at a certain point. I went to therapy personally to work through my own grief, but we
Mm-hmm.
also went to a couples therapist because we were experiencing grief differently. We weren't always aligned on like kind of how quickly or what next steps we wanted to take. Like
Yes.
we were just going through the process as best we could ourselves, but that didn't always match up that we were going through it well together.
Mm-hmm.
And so it was really, yeah. I mean,
Mm-hmm.
I think that there are still things that happened going through that impact our relationship now
Yeah.
that we have to continue to figure out how to integrate that or heal from it.
Yep.
And
I appreciate you naming that. It's kind of relationship specific, and you're right. There's a lot of attention that, I think should be paying to the partner relationship because when you think about what recurrent pregnancy loss does to how you relate to your own body, of course, that's going to impact, how you are able to kind of derive pleasure again, and part of being in a couple is about how you express yourself physically. And when you're, in that idea or that narrative that, procreating should be easy and it's fun and the fun part's the trying, I think, sometimes what, we also hear, but when it's not fun, when it's become medicalized and also traumatized, it impacts the individual's experience, but also the couple's experience with that. And so I'm glad that you and your husband were able to kind of seek some support therapeutically. And I also appreciate you being real about the fact that, even years later, there are ways that you're still integrating. And so, it's part of the process of how we move through it, I think is important to name.
And I mean, and I, like, your body remembers, like internally it remembers. And so, I remember even saying to him and, like try to be, I try to be fully transparent, but it's like,
Yeah.
you say, okay, we're doing this thing, we're doing this, like this intimate act that has led to many instances of trauma and pain for me. So
Yes.
it's hard to go into that space, even if that's not the intended outcome now. You're still going back to that space that led to a really painful path. And
Exactly.
having to like say to your mind, this is a different, like
Right. Right.
hard. It's hard to do.
It's
Yeah.
really hard to do. It's really hard to do. And how can you, kind of separate the intimate times that were geared towards, procreating versus the intimate times that quote unquote should be about connecting because they kind of get fused together. And then it just becomes, I think, really hard to, I think fully show up in a way that's really meaningful. And you also said something too that I think is important, because I talk about this with, some of my clients, and it's the fact that, sometimes partners aren't on the same page about how they want to move forward, what treatments to do, even when to try again or not try again, the timing. I mean, there's so many elements of the process that there are points of where there might be points of differentiations or, points of difference. So I appreciate you sharing that. I think more people need to know. More people need to know. One thing I want to kind of circle back to, because when you talked about your grief and how it was showing up, and you noticed a lot of anger coming out, particularly the medical system. And that makes me think about just some of the gaps that we have, medically or systemically in reproductive, in reproductive health in general. And so I'm curious, what was your experience like with providers or the medical system? Can you share a little bit more about that?
Yeah. And it's interesting because, my perspective now is different than it was going through it. And I have said many times publicly, one of my doctors was Dr. Laura Shaheen, who is very prolific on social media. And I've been on her podcast, and and she's wonderful. But I said to her, I didn't ever consider the perspective and the position that my doctors were coming from. I think if you're not a healthcare provider, you're like, you guys went to school for this. You study this. Why can't you tell me what the answer is?
Right.
And the more now I can understand, God, medicine is an imperfect science. It's a constantly evolving field. Everybody's body is different. And so the expectation that they would have the answer for me was maybe a misplaced expectation. But so much of my anger was why can't you tell me?
Right.
And it's because the answer maybe isn't known by anybody at this point.
Right. Exactly.
And so I will say that once I got to specialty care, it wasn't hiccup free or perfect. I certainly have thoughts about where there could be areas of improvement, but the specialists that I saw, I think were wonderful.
Okay.
Which is not to say that the OBs that I saw weren't wonderful. They were, but the biggest piece that I find frustrating now in doing this work is the lack of investigation that happens in that, in those earlier experiences of loss. I do really think that it gets just brushed aside as this is common, try again.
Right.
There is no inquiry.
Right.
There's no thought that, well, maybe there might be something that's going on that we could get ahead of to prevent future negative outcomes. And that's where I really think there needs to be an intervention, a different intervention point system-wide.
I completely
agree. Investigate earlier, ask follow-up questions. Even if the answer was, hey, this pregnancy had a chromosomal error and it was never going to be successful, having that actual empirical data, I think would have helped.
Very much so. Very much so. Absolutely. And I appreciate you also saying that, that medicine is an imperfect science, because as much as we think about, it's grounded in data and replicating data and reliability and all of that. It's still not 100%. And, and that coupled with the fact that there isn't always the investigation or the curiosity that, might be helpful. And the fact that, sometimes people have to go through recurrent pregnancy losses in order to get more specialized care. And as you were talking, I was thinking about a tad bit different, but a client that I worked with years ago who dealt with cervical insufficiency. And sadly, had to go through one pregnancy loss in order to determine that she had her cervix was not operating as it should be. And then second pregnancy loss after having a cerclage. And, in some ways, she had to really fight for having a procedure that's called a TAC. And I can't remember what that stands for, but it's definitely much more of an invasive kind of procedure to help people hold pregnancies. But just thinking about the process to be able to get to that and how much loss that she had to experience in order to qualify for that, when in some respects, probably by the third loss, they should have, known better. But, but yeah, I appreciate that. Like just wanting more curiosity early on and kind of having that data.
And I think it's like we have to kind of shift. There's an organization in the UK, Tommy's, and they like their tagline is like miscarriage is preventable. And I think like we need to kind of just get to, yes, maybe not all pregnancy losses in all circumstances, but just going to a place of like, these things can be preventable. And they should be.
Yes, they definitely should be. And I'm curious, what do you wish more doctors or, medical providers understood about recurrent pregnancy loss?
What do I wish that more doctors understood? At the risk of repeating myself, I wish that first losses were considered a medical event. I mean, really, I like truly considered a medical event that may have other health implications that were caused by something that may lead to other somethings. Like, I want that to be a point that is the same way that like, hey, I need to report a history of like blood clots and maybe I need to think about X, Y, and Z in the future. I think that miscarriage and pregnancy loss should be considered real events. I think also there is a huge, system gap. And you're probably in a better position to answer this piece, but I don't think that the mental health toll of pregnancy loss is adequately addressed.
Right.
You can seek it out separately and then find like very good care providers, but not everybody is taking that initiative. And I don't know if there's enough focused like points of intervention to really check in on people's mental health as they're going through this.
Right.
So I think there's a huge area for improvement there. And then I think the third thing is like the ER needs to do better. The most traumatic experiences always that I hear from people are when they went into an ER because of a pregnancy complication. And while I can appreciate that it might be handled differently than like a heart attack and that you need to do those things differently, like there is room for improvement.
Yes. A lot of room for improvement, in terms of, how do doctors really address, I know that doctors don't get a lot of patient time, but even a quick, how are you holding up emotionally could just go a long way as, in addition to, their examination and tending to the body or the physical body. But I think just tending to the mental kind of space and setting the stage for, yes, that is part of your healing and your care. Yeah. And then also, I think in the loss, being part of the larger loss community too, just, making sure some of the other medical staff are, really briefed on how they how they ask questions about, pregnancy loss and reproductive histories, and maybe even reading it and knowing like if somebody has written that they've had multiple pregnancy losses, but you're still asking them, how many children do you have, or kind of thing. It's like that disconnection, I think, can be really jarring. And so those are just a couple of examples that come to mind, but I'm sure a lot more.
And there are things that some clinics do, and that I've heard, I've heard doctors talk about, they put, a sunflower sticker on the door of the room if there's going to be someone going in, or they make sure in the morning to flag the charts of anybody that has experienced, a perinatal loss, so that the whole, and then they've trained their staff on, hey, when you see these things, there are ways to do this. It takes effort and time, and somebody who understands that that's an important effort and time to take.
Exactly. Yeah. And I know that they have that in some hospitals, so it makes sense that they would do that in some clinics as well. Yeah. But I think that's definitely a practice that could go a long way, for sure. Because we know that with this experience of recurrent pregnancy loss comes a lot of grief and triggers, and and as you're trying to figure out ways to cope. And so I'm curious, how did you grieve each loss, and what did you notice about how your grief changed over time?
I'm like, not well. I don't know. No.
I love your humanness.
Certain things became bigger triggers over time, I guess I would say. I definitely, the longer that I was experiencing it, there were friends' social media accounts that I unfollowed because it was it was too hard to see the pictures of happy families. Certainly,
Yep.
certainly some of the common ones, like there were a couple years that I just made my husband open all the Christmas cards. And I was like,
Yeah.
just throw them
Yes.
out if they've got a
Yeah.
baby in them.
Yep.
I don't need to see it.
Yep.
Like, so there
Yes.
were some common things like that. From a medical perspective, there did come a point, and this was because the IVF is just so many appointments.
Mm-hmm.
I do remember there was a point at which I finally told, my husband's name is Ben, and I finally just said,
Okay.
I need you to be at every appointment. Like
Yes.
literally, I need you at every single appointment. If I'm going in for a blood draw, you're there. If I'm going,
Yes.
and I think because it was both emotionally difficult and I felt such a burden of time
Mhm.
going into this. And I was like, I need this to be shared a little bit.
Yes.
So
Yes.
there were things like that that I think like grew over time. In terms of like grief, I started to, I don't know that it was giving myself permission or if it was just like my body finally made it impossible for me not to.
Mhm.
But I did start to take more time away from work, recover. You know,
Mhm.
the first couple losses, I truly was like same day back in the office, just like,
Yeah.
I know that sounds horrible, but so many of us do it. And I think about my last loss, I emailed and I was like,
Yeah.
I'm gone. Like,
Yeah.
I'll come back next week. Don't
Yes.
reach out to me. And so I think I got a little bit more willing to give myself the space, probably because I needed it.
Yes.
But I would say to other people, I wish I'd done that earlier. I wish I had recognized that I was experiencing something that was important enough to take that time
Yes.
earlier.
No, I'm sitting here nodding and, jotting down my little notes because I think that, everything that you shared just reminded me of my experience as well. And, I think, at the first couple of losses that I had, I right back to work. And I remember the first pregnancy that missed miscarriage. I don't know how you decided whether you did a DNC or whether you allowed your body to try to miscarry naturally. And I chose the latter. And that was traumatic. I remember being at work and in the middle of a client and I'm starting to have labor pains and they knew I was pregnant, and then it was just like a weird kind of thing. But it was almost like going back to work was something I needed to do in that moment because I couldn't accept the reality of what was happening. And that was a way that it was almost like if I didn't kind of accept it, then was it really happening kind of thing. So that piece around allowing yourself space to grieve and to, try to do that earlier, I think is just really powerful and, sound advice. And, and then just as you're kind of healing and coping, it's in some ways needing to avoid social media or, have like your husband, like look at the Christmas cards so you don't have to deal with those constant triggers. And I remember even being in like group chats with some of my friends who had children and, there's just all this kid talk. And I remember one point just saying, is there anything else we can talk about besides kids? I love talking about your kids and I've done that for years. It was just so hard, to hear. And that was actually a turning point too, in terms of how they were able to support me because they were just like, we were just doing that because we didn't know how to hold space for you. But thank you for telling us how you feel. It's like really learning what you need and giving yourself permission to ask for it, even if it's not graceful, because it's not going to feel graceful. It's going to feel, I think, uncomfortable. And, if you're feeling uncomfortable, it's like you need to pay attention to that. Yeah.
100%.
Yeah. So
You're right. It's so personal. We all feel supported and need to be supported in different ways. So
yes,
yeah.
for sure.
It's self-inquiry even in that place. What makes me feel supported is entirely different from my sister, and we're the same family.
Exactly. Exactly. And so I'm curious, what does healing look like for you now? As you think about your journey through grief, what does it look like for you right now? What helped you kind of reclaim parts of yourself or rediscover or discover new things? But I'm just curious, where are you now?
Yeah, it's a good question, and it's still such a process. I
Mhm.
think so. I didn't say at the beginning. I actually do have two children.
Okay.
So I have a daughter that was born via gestational surrogacy, and
Mhm.
then I have a younger son who I was able to carry and deliver.
Oh,
And it's both of those were transition points and healing points, and in sort of different ways, but difficult. Like when my daughter was born, and I think particularly because I hadn't been gone through the experience of being pregnant with her,
mhm.
there was a lot of work of how do I integrate this experience now that I'm a parent? Like
Yes.
and I think a lot of us, it's like, especially if you've lived a long time in this sort of like infertility and loss community, which identity do I have now? Am I
Yes.
still this? Am I still allowed to be sad? Even though I'm now grateful, I know how much pain it caused me when I was seeing other people as parents. I don't want to impose that pain on other people. It was really hard to figure out, how do I show up? Which hat am I wearing? And
Yeah.
how does it become the same one?
Mhm.
And then with my son, I think that really started a process of, which is still not over, like kind of healing some of the body trauma and like forgiving my body a little bit.
Mhm.
But, here, okay, well, there's this thing that I literally never thought my body would be able to do, and now it's done it. And like, what does
Yes.
that mean? And like,
Right.
how does that change my perception of being broken? And
Mhm.
so
Mhm.
it's still happening. And I think
Yeah.
that's the piece that like, it's even now, it's like I still lived through this. It was still a turning point in my life and something I don't want to ever let go of. But how do I hold that space for myself in a way that is healthy and allows me to move forward? I don't have the answer. It's like
Yeah.
constant work.
Yeah. No.
Yeah.
And again, I think you're speaking to the process,
Yeah.
and how grieving and healing is a process. It's not a destination, but it's a journey. And the piece around trying to figure out what hat do you wear
Yeah.
really hit me too, because when you spend a lot of time and loss is a huge part of your experience and your identity, when you do transition into this next chapter, how does that get integrated? How do you honor when the loss comes up, but you're still kind of in these moments of joy with the child or children that you have now? And then what is the experience like, welcoming a child via surrogacy and making that hard decision? And then also, welcoming a child through your own body and just how does that get incorporated into your narrative, to your stories? So it's definitely a process. But one thing I do believe, and then I think this kind of goes back to my early days in grad school and training, about just sometimes not having everything figured out, but just sometimes allowing space for two seemingly opposed feelings or thoughts to kind of exist is a powerful part of the healing process too. Like in some ways, the integration just kind of unfolds, with that allowance of that experience. So I appreciate hearing that. That you're still a work in progress. And yeah, I'm wondering, can you tell me a little bit more? I'm going to transition a little bit more into how all of this has, impacted like what you're putting out into the world. And I know that you mentioned that, RPL, or Recurrent Pregnancy Loss Association, kind of came to be, based on, your own personal experiences. And I'm wondering, is there anything else that you want us to know about, what your association is doing right now to support the community?
RPLA does a lot of things, but in three kind of big buckets. So one is very much focused on science and research and going back to that, like wanting to find more answers for more people. So a good portion of what we do is directly funding research into recurrent pregnancy loss, and then doing some, research ourselves on the lived experience and the like kind of qualitative aspects of that. A second kind of bucket or pillar of what we do is community support. So we've actually just expanded our support group offerings. But we're offering 4 different types of support groups. They're free, they're virtual. They're usually, all of them are on some version of a Monday night from 5 to 6 Pacific, and then all the other time zones included.
Yeah.
And with support groups, it's so funny because I never joined a support group. I'm like, I don't know if you could have even paid me to go to a support group. And now I'm like, everybody should go to support groups, and like everybody should have a therapist, and everybody should, like, I think the more support, the better in this experience. And then a third bucket is a lot about just kind of raising awareness and putting out educational materials, both for people that are trying to navigate this experience themselves and also for providers who are trying to support people in this experience. And so those are kind of the buckets of what we do.
I love that. I love that. And I just kind of chuckled when you mentioned the piece about support groups, because I had the same feeling and kind of have a love-hate relationship with groups, and luckily what I was able to find at some point in my journey too was a bunch of therapists who were going through what I went through. And because I think that I also needed to talk about how was this affecting my work, and it was kind of a unique experience. But I think the groups are really about establishing community and, helping people feel connected and anchored in that loss and with each other, because I think that's a huge element of how healing occurs, in that relationship and feeling seen. So it's nice to know that that's part of your association. And I also happen to know that you have a big event kind of coming up in a couple of months. And I'm wondering if you might want to talk a little bit about that.
Thank you for the plug. Yeah, actually coming up really soon. So I don't know when this will air, but we can figure.
Yeah.
But yeah, from August 23rd to September 6th, that's the window. We're doing our first virtual walk, run race. Virtual means like you can do it from anywhere. Even a treadmill counts. Like you sign up for a distance. It's very accessible. There's a 1 mile distance up to 10K. And so you do your miles anywhere and put in your time online, but you can buy your Hope in Every Step gear and just help us raise awareness from wherever you are for RPLA and for the experience of recurrent pregnancy loss. And we picked this window of time because August 30th is National Grief Awareness Day. And so it's sort of, this is a profound grief experience that sometimes feels a bit disenfranchised. So raising awareness around this period of time for this experience of grief.
That'd be great. That's great. And I'm wondering, are there any other events that might be coming up maybe in November that you want to talk about? Or are you free to talk about that?
Yes, thank you. You can tell that my mind is like very focused on recent one.
As it should be, as I get it. I totally understand that.
Thank you for the plug and the nudge. Yes, and you will be helping me with that. So this is actually huge because RPLA has been asked by ACOOG, which is one of the major medical societies for general OB providers. So it's the American College of Osteopathic Obstetricians and Gynecologists. They are doing a full day continuing education course on recurrent pregnancy loss. And so it's virtual, so people can attend from anywhere. It's also free for medical students and residents. So if you're in training and you want to learn more about how to provide care for this community, I really encourage everybody to join. And then anybody that's currently in practice as well. But Loree, you will be facilitating a panel discussion at the end of the day that I will participate on as well to talk about the mental health aspects of this. But it's also going to touch on a lot of the clinical care aspects of this too. So yeah, that's November 15th. It's a Saturday. And so it shouldn't interfere with many clinic hours or all clinic hours, and really big plug for people to join that.
Yeah, I'm so excited about this event. When you reached out to me, I was like, absolutely. Because we know how hard it can be to connect with the medical community and to have some major interest, in training upcoming, healthcare providers on this aspect of care is a huge opportunity. And so I'm, so glad to be a part of that and so honored that you thought of me. But I think this is just really speaks to the powerful work that you're doing, to raise awareness, to advocate and educate people in our community and people who serve our community.
And shout out to ACOOG for being interested in this event, because I will say, they're the first society that's membership is really that primary OB care support that has done this. And so I think big shout out to them.
God, yes, definitely, definitely. So, final thoughts. I'm just curious if you could, share, if you could speak to someone who's just beginning this journey of recurrent loss, what would you want them to know?
I was thinking about this question before the conversation because I think I'm so sorry is the first one. I'm so, so sorry.
Mhm.
And I think the other thing is, and it's not your fault, but beyond like it's not your fault, like taking that to, yes, of course you didn't like cause this, but also none of the micro decisions that you made or didn't make. I think that so frequently people that are experiencing infertility or experiencing pregnancy loss are so worried about did I choose the right treatment plan? If I hadn't chosen this treatment plan, then maybe this would have worked out differently. Did I not take the right vitamins? If I had taken the right vitamins, this wouldn't have happened.
Right.
It internalizes so quickly. And that's where I want to you're doing everything right.
Yeah.
You're doing the best you can. This is not your fault.
Yes. Absolutely. Absolutely. Just really reminding people that they're doing the best they can with what they know. And this is not about being perfect, and really taking the blame outside of them is important. So I appreciate you sharing that message. And I hope that people who need to hear that can really take that in. And so I'm wondering, where can people find you, Megan?
Yeah. So hopefully I'm very easy to find. So you can find me. Our website is rplassociation.org. And then all the other links are there. But I also post as regularly as I can on Instagram. And our handle there is also RPL at RPL Association. So same website, same Instagram handle. You can find my email all over the place, but please feel free to reach out, follow, get involved if you'd like.
Perfect. Perfect. Well, I want to thank you so much for being here. I've really enjoyed, our conversation and our time together. I'm just, so honored to be in community with you. And so having, this time was really a treat for me. And I just am so anxious and excited to, have our community listen to this and to, hopefully this be another avenue to support them.
No, thank you. And thank you for everything that you do for the community. I'm really excited that you're starting a podcast. And I think I'm glad that there will be more ways for people to find your content and hear your voice, because I have so much respect and for you as a person and what you do.
Thank you. Thank you. There's definitely a lot behind the scenes, that kind of got me here. And I appreciate finally getting here and, being able to serve our community a little differently. And so one final thought that I have for the community, I just want people to know that, recurrent pregnancy loss isn't just like a string of medical events. It's, deeply layered and sometimes traumatic experience for people. And even though it really reshapes our relationship with time, our body, and maybe hope as well, we find different ways to grieve, to keep going, and maybe not always with clarity and not always with strength that feels very loud, but still with, grief that deserves to be seen and validated. So if you are living with the echoes of recurrent loss, please know that you are not alone and that this is not your fault, and your pain is real and your story matters, even if the world doesn't know it or hasn't made space for it. But I want to thank you for listening today to The Layers We Live. And if this episode resonated with you, I hope that you would share this with someone who might need to hear it. And if you'd like to hear more conversations like this, please be sure to subscribe and leave a review, because it really helps others find their way to the support that they need to. Until next time, please take care, and remember, you're not alone in the layers you carry.